Joining us now is Dr. Rimoin, epidemiology professor at UCLA and an expert on monkeypox. So, as you know, Dr. Rimoin, WHO Director General, said that, quote, we understand too little about monkeypox. And you, in your 20 years, you've researched monkeypox in the DR, Democratic Republic of the Congo. What have you discovered about the disease that needs to be understood immediately and without mistake or confusion?
Well, Arthel, thank you for having me. And yes, I've been working on monkeypox for 2 decades in the Democratic Republic of Congo. And I can tell you, we know a lot about monkeypox in the context of low resource settings, places like DRC, but we really have to be humble about what we know about how this virus is going to be spreading and what the potential is for global spread, in a high resource setting. So what we're seeing here now is this virus is spreading quickly with very close person-to-person contact, but this virus can spread in a variety of different ways. It can be spread by what we call fomites. If you have inanimate objects have been contaminated, like sheets or towels or clothing, it can be spread person to person. And so as a result, we really need to be careful. We need to understand exactly how it is spreading, how quickly it is spreading, and we need situational awareness. That means we need really good testing. We need really good case definitions so that clinicians can understand it. And that way we'll have much more situational awareness.
Well, boy, so many follow-ups to that. First of all, the fact that you said we need to be humbled, and you're one of the foremost experts on this virus. So, I appreciate that because, as you said, I mean, you're still learning, even though you've had 2 decades of studying. So that is important that you said that, and also something you said about that it can live on inanimate objects. I want you to address that for me, specifically, what does that mean? And also, until very recently, we were told that men in the gay community were most at risk of getting monkeypox, and now you've got a toddler and an infant that have gotten the virus. So how do you explain that, and should the general public be concerned?
Well, this goes back to, so to answer your second question, this goes back to what I was saying at the beginning. This virus has a variety of mechanisms for spread. So first being very close personal contact, and that's what's happening in the community of men who have sex with men. But that is not the only way that it spreads. In fact, in Africa, what we see, it's often from an animal exposure, and then often we can see this person-to-person contact, which then continues on. And that can be from if somebody who is sick has contact, the lesions are in contact with bed sheets, clothing, those things, then somebody else who's in contact with can get it. So there are a variety of ways that it can spread, which makes sense that you'll see it not just stay in the community it's spreading in right now, the MSM community. It'll spread, everywhere. And I've said this before, an infection anywhere is an infection potentially anywhere. And viruses never just stay in one community. We all live together. There's a lot of travel. There's a lot of trade. There's a lot of mobility here. So that's what we'll probably see.
Yeah, and as you well know, vaccine dosages are different for children and people of different ages. So how does this compound the production and distribution of monkeypox vaccines?
Well, what we know is that vaccines against pox viruses, smallpox in particular, protect also against monkeypox. We have several vaccines available. The first of which is this Jynneos vaccine, which is a vaccine. It's a 2-dose vaccine, but we have very small stocks of it at present, although there are orders for a lot more. That is going to be available more. There are going to be more and more doses available of this vaccine. There are other vaccines like ACAM 2000, which is another vaccine specifically indicated for smallpox, but could also protect against monkeypox. And so there may be some discussion about using that vaccine as well. But there are vaccines that are very effective in terms of reducing the potential for infection and onward spread.
So we'll wait for CDC guidelines as to when they're available, who should get them, et cetera. Viruses, Dr. Rimoin, that once never or rarely traveled to America now seem to be spreading here. Is this the new normal, or maybe is my question hyperbolic?
I think we are in a new age of travel, trade, population mobility. We also have population continuing to expand. So we can anticipate that we will see more viruses moving from one place to another. And that's why we always have to be thoughtful about, we see these viruses spreading, for example, in Africa, and there have been very little funding available to be able to do the kind of work to be able to control the viruses at the places that they are endemic or places where you see a lot of spread. We have to remember that we are all interconnected. So the way that we are going to get in front of these viruses is to invest in public health infrastructure here in our own country, but also to care about what's going on globally, because what's happening elsewhere will eventually arrive here.
No, that's an excellent point, that we have to, provide resources to try to stop the virus at the source, and also just compassion for people. Dr. Anne Rimoin, always enjoy speaking with you and appreciate your expertise. Thanks so much for joining us.